To accommodate growth and evolving technology, Kaiser Permanente moved from an existing building to a new state-of-the-art facility in Oakland, California. Left behind were all the old furniture, fixtures, and equipment. Thus came the challenge of responsibly decommissioning the old facility. Kaiser Permanente partnered with ANEW to create the strategy for surplus stewardship, dismantling, removing, and repurposing over 5,000 items, all potential assets to help charities, public agencies, and nonprofits continue their good work. It's a complex process with many moving parts. This is how it all worked out.
Part of that work has included the diversion of waste from our construction sites. And part of construction, as you know, includes demolition. And when we're ready to demolish a building, and prior to doing that, we need to empty it out. And we need to make sure that we're able to recover, repurpose, recycle as much of that building prior to demolition.
We've moved across the street. We're in a brand new 1 million+ square foot state-of-the-art hospital here in Oakland. We call Kaiser Permanente Oakland the flagship.
I started as a member of the rebuild team, which basically was working as a project manager on this new building that we have here. And then once that project ended, I was able to go over to the old building and work on the actual tear down and demolition of that building. So the Legacy building is a huge hospital. It was Kaiser's flagship hospital. It's 370,000 square feet, 13 floors. It's a huge task. And there's tons and tons of assets there. There's everything from bookcases and desks and medical supplies. And that basically means to defer them from going into the landfill and try to repurpose them back into our community.
We are going to use this furniture donation for one of our shelters that's in Hayward, as well as for a new office that's opening to provide reentry services for recently released prisoners. Thank you for supporting our agency.
I came here today with an opportunity from Kaiser to furnish our health center at Pinole Valley. And today I picked up 3 task chairs and a stacking cart and a rolling cart, and I got an opportunity to receive a refrigerator also for the health center. And so I just want to say thank you for the opportunity from Kaiser. This is great for us to be able to furnish our health centers to service our students.
Kaiser Permanente did a really phenomenal job in figuring out how to really deliver value to the community with our materials. We really thought from the perspective of how can we, fulfill our mission and ensure that those materials benefit the community. And that was really, really difficult because there are so many really bizarre, nuanced materials in these buildings that are very particular to healthcare, that are affixed to the walls.
We were contacted by our partner ANEW, who was working directly with Kaiser Permanente on the disposition of product from a medical facility. And we had just coincidentally received a field request from the Ministry of Health in Zambia that they were looking for particular equipment to fill this health clinic. And they gave us a list of items that would really help their initiative: patient beds, wheelchairs, infant cribs, IV poles, many things that we would never normally get donated in the processes of our work, and items that are extremely expensive for them to purchase when they're trying to serve so many people on such limited funds.
I do want to acknowledge and thank Kaiser Permanente for their generous donation of pastures for our newly constructed health center. It's wall clocks that will go to very good use. We thank you for supporting our health center and our communities.
So as a community benefit manager, my work is about relationships. In terms of this project, we surveyed our community partners and asked which of them had needs for medical equipment and office furniture that were no longer being used within our facilities. And essentially we participated in a matchmaking exercise. Based on what was available, we typically keep an inventory of what's here and being stored. And we share that with our community partners that we know have similar needs. We make sure that they have the capacity to pick up, store, and use the equipment or furniture, and we provide a warm handoff essentially.
We're really happy that Kaiser was able to help us with supplies that are gonna help with our clinic. We provide thousands of community members with free medical services, and as a grassroots organization, these supplies will go a long way to make sure that families and individuals who reside in Oakland and Alameda have the services that they need.
The reason why the in-kind contributions, which is what we call furniture, equipment, supplies that are decommissioned from our medical facilities, donating those are really important is because it's one of the examples of how we show up beyond the dollars.
I'm so thankful today to be receiving a big donation from Kaiser, organized by ANEW. ANEW has made it possible for us to now have functional chairs and a new desk and a bookshelf in our office, which is just going to make, our day-to-day tasks and work life so much better at our nonprofit. And that way we can also put the funding that we're receiving other places back into our program so we can be serving our youth in Richmond. So thank you so much, ANEW. The work that you are doing is amazing for us.
They didn't want anything to be thrown away. That was the one thing that was stressed more than anything when this position began. And at first I found it to be a bit challenging, but now I find it to be a bit rewarding because it's made me look at the way that we reuse items, the way that we look at waste, the way that we look at things that are considered to not have value. And it's crossed over to not only my professional life, but my personal life as well.
Pues queremos agradecer a Kaiser Permanente por haber donado las cosas mesas, sillas, cosas que se necesitan en nuestra organización. También venimos solamente por ciertas cosas, pero ahora nos invitaron a tomar más cosas, entonces pues tomamos unos refrigeradores extras, sillas y todo que nos van a servir mucho. Thank you very much.